The commonest symptom that people, I think, are familiar with is the tremor. And there are four what we call cardinal symptoms of Parkinson's: tremor, stiffness, slowness of movement, and difficulty with balance. The tremor typically is when the hand is still or resting, and it's what we call a pill rolling tremor, where the thumb rotates across the fingers. And it's so-called pill rolling because in the old days, pharmacists used to make their own tablets and they would roll them between their thumb and fingers. It usually starts on one side, but it may be on both sides. Another very common symptom is rigidity or stiffness. And typically when I examine a patient, I move an arm up or down. It's a nice, smooth, fluid move. With Parkinson's, it's a stiffer, kind of ratchety movement that we call cogwheeling. And that's very typical of Parkinson's. It can be seen with other types of tremor, but it's really most commonly seen with Parkinson's. Slowness of movement is one of the very, very disabling symptoms. And typically patients will interpret it as weakness. They can't do what they want to do. But when you examine them, they have the muscle strength, but the movements are very, very slow. It makes it difficult to roll over in bed. It makes it difficult to stand up from a low chair, to get in and out of a car. Things like doing up buttons become very difficult. Handwriting becomes very difficult. Typically, the writing becomes much smaller in size and much more cramped. The last of the four major symptoms to develop is difficulty with balance. And a lot of these patients have a great deal of trouble and they fall. And when they fall, they go down with a crash.